Hello, I'm Linor Moudou. Thank you for joining us for another edition of Healthy Living. Epilepsy is a chronic neurological condition of the brain that causes recurring seizures. The seizures are sometimes accompanied by loss of consciousness and uncontrolled bowel or bladder function. The World Health Organization says around 50 million people worldwide have epilepsy, and nearly 80% of them live in low and middle income countries. Let's go to Malawi, where 55-year-old Harry Singano has battled stigma and misconceptions for the past 33 years that he has lived with epilepsy. Reporter Chimwemwe Padatha brings us his story.
An accountant by profession and employed in the civil service, Harry Singano considers epilepsy like any other disease. Singano, a 55-year-old father of 4 children, was not born epileptic. He was diagnosed with the disease the past 33 years. At the onset, close relations attributed his condition to superstition.
From my own knowledge, from my own belief, it's not because of my workmates. No, nor my relatives, not at all. Epilepsy started in my body because of perpetual drunkenness.
Singano's epilepsy journey and experience with stigma and discrimination has led him to become a champion of change.
I just want to tell them to strictly follow what they are told to do. If they find any problem, they have to be free. There are certain people, because of epilepsy, they say, I don't know epilepsy. I can talk to somebody. I don't know about epilepsy. It's not supposed to be like that.
Epilepsy can develop in childbirth when children have suffered trauma during delivery, says Dorothy Ngoma, a seasoned health professional and safe motherhood advocate.
I have seen this, and over time you follow these babies who were, had delayed deliveries. They tend to get epilepsy. It's although some people may believe to say if you have somebody with epilepsy in the family, maybe it's passed on from family to family, or sometimes they believe to say if they are having convulsions, don't be near them because you'll be affected if they fart or something like that. The air around them is infectious, which is wrong. It's not true.
International Bureau for Epilepsy, an advocacy and lobbying organization that fights for the rights of persons with epilepsy, has made inroads around awareness on epilepsy in 16 countries in Africa, including Malawi.
We decided to come up with several interventions. One, we have awareness programs that we support as an organization. Currently, we are supporting 6 countries within Africa where they have full-fledged programs around epilepsy.
A 2023 World Health Organization Country Disease Outlook report shows that non-communicable diseases, NCDs, are still a major health problem in Malawi. Malawi Ministry of Health says it has taken measures to respond to the high disease burden of the NCDs.
This is a non-communicable disease, and actually it's manageable. When one is taking medication religiously, people wouldn't even know that this one is epileptic. So we are developing so many messages, including those on epilepsy.
But even if patients like Singano can control their seizures, stigma and discrimination against those who suffer from the disorder can always be contained. Dispelling misconceptions against this group should therefore be prioritized. Chimwemwe Padatha, VOA News, Lilongwe, Malawi.